The delivery room was silent, too silent. The monitors that should have been alive with tiny flickers of hope were flat, cold, unchanging. Nurses exchanged uneasy glances while the mother, exhausted from hours of labor, waited for a cry that never came. The smell of antiseptic hung heavy, mixing with the metallic tang of fear that no one dared to voice aloud. The doctor lifted the infant carefully, his hands trembling despite years of training. The child's skin was pale, almost waxen, and limp against his gloved fingers. No heartbeat, no breath, no sound. He whispered the word no parent ever wants to hear: stillborn. And with that, the mother's dream collapsed into unbearable silence, her tears filling the void where life should have been. Nurses began the routine they knew all too well, covering the infant, logging the time, preparing the chart, a ritual of endings, performed with mechanical precision. Yet something about this case unsettled them. The room felt charged, as if unseen forces lingered. The air itself seemed thicker, heavier, waiting for something unspoken. Then, in the midst of sorrow, a nurse froze. She leaned closer to the child's tiny lips, swearing she saw the faintest flutter, not of the blanket, but of breath. It was absurd, impossible. Her colleagues shook their heads, but she insisted, her voice cracking. "Look closer. Did you see that?" The doctor returned, skeptical but compelled, his eyes narrowing. What happened next would defy every medical explanation. The impossible was about to unfold before their very eyes, rewriting the boundaries between life and death. The stillborn child was about to prove that sometimes, even in medicine, silence can be broken by a single miraculous breath. For centuries, stillbirth has been one of medicine's darkest tragedies, a moment where science and hope collapse together. Families are left with unanswered questions, and doctors with heavy hearts. But every so often, a case emerges that challenges everything we thought we knew, blurring the line between the finality of death and the spark of life. In this case, a newborn was declared lifeless after delivery. No cry echoed through the sterile walls, no pulse registered on the monitor. By every clinical standard, the baby was gone. Yet what followed was so extraordinary that even the most seasoned physicians would later admit they were shaken to their core. At the center of this shocking event was a young mother who had prepared for joy, only to be confronted with despair. Her story begins in a modest hospital, with nurses, midwives, and physicians who thought they had seen it all, until this child rewrote the rules of medicine in a single breath. To understand the magnitude of this moment, it's important to know that stillbirth occurs in about 1 in every 160 pregnancies in the United States. Despite medical advances, it remains a painful mystery, often without a clear cause. But in this case, the phenomenon wasn't just rare, it was nearly impossible. A stillborn child suddenly breathing defies both science and expectation. This is not simply a story about biology or statistics. It's about the fragile border between life and death, about grief transformed into awe, and about how one impossible moment can leave both families and doctors forever changed. And as you will soon see, the truth behind this revival is as shocking as it is miraculous. If you enjoy incredible medical mysteries with shocking twists, don't forget to subscribe and comment the word miracle to join our community. I remember the first contraction striking harder than expected, a wave of pain that bent my body and stole my breath. The maternity ward smelled faintly of antiseptic and warm linens, a mixture of safety and unease. Nurses moved quickly, adjusting monitors, preparing for what everyone believed would be a normal delivery. But from the beginning, something felt off, as if an invisible shadow hovered over the room. Hours stretched on, each contraction stronger, yet the baby's heartbeat on the monitor flickered inconsistently. A soft alarm beeped, then steadied, then dipped again. The doctor's brow furrowed as he adjusted the transducer. "Sometimes it's just movement," he assured us, but his tone betrayed doubt. Every nurse's glance told a different story, concern hidden behind practiced professionalism. When the final push came, I braced for the cry I had dreamed of hearing, but silence swallowed the room. My chest tightened as the doctor lifted a limp, pale infant, the umbilical cord still wrapped loosely around his neck. There was no sound, no movement, nothing. The silence was deafening. My world tilted in that moment, and I felt myself falling into an abyss of grief. The medical team moved with grim precision. They rubbed the baby's chest, suctioned airways, tapped the soles of his feet. Nothing. The monitor showed only a flat line where life should be. The doctor whispered, almost reverently, "Stillborn. The words struck like a hammer, final and merciless. Tears streamed uncontrollably down my face as the room dissolved into sterile routines of endings. In those painful minutes, I noticed a detail that gnawed at me. His lips, slightly parted, held a trace of warmth. Was it just my imagination? My heart clung desperately to what science denied. I searched the nurse's eyes, hoping one of them had seen it too. But all I saw was pity, the kind reserved for the irreversibly broken. The official cause scrawled on the chart, intrapartum stillbirth. Statistically, 1 in 160 pregnancies ends this way. Doctors call it unexplained intrauterine demise, when no clear reason exists. It's a cruel phrase. Clinical, detached, empty of humanity. Behind those words, mothers bury their children, and medical staff carry silent scars that never fade. Yet, beneath the harsh fluorescent lights, a nurse hesitated. She lingered longer than usual, her hand resting lightly on the baby's chest. "Doctor," she whispered, "there's something odd." The physician dismissed it with weary authority. "It's just residual reflex, nothing more." Still, unease spread through the room like smoke, impossible to contain. The minutes ticked on, each second heavy with despair. I forced myself to memorize his face, terrified it would vanish from memory too quickly. The texture of his skin, soft yet unnaturally cool. The faint smell of blood and iodine. The sound of the monitor's relentless flatline, cutting through hope like a blade. Everything about this moment screamed finality. And then, as if mocking science itself, the faintest twitch passed across his chest. So small, so fleeting. Most dismissed it as an illusion of grief, but the nurse's eyes widened. "I swear, I saw it." The doctor shook his head, unwilling to raise false hope. But doubt had been planted, and with it, a question none of them dared speak aloud. Could a child declared stillborn truly draw breath after death? The answer, hidden in that fragile body, was about to challenge everything medicine thought it knew. The delivery room tried to return to routine, yet unease clung to every corner. Nurses whispered as they prepared to move the lifeless infant to the side crib reserved for tragedies. But then came a sudden, shallow gasp, so faint it might have been mistaken for air shifting in the room. The nurse closest froze mid-step, eyes wide, her clipboard trembling in her hands. "Doctor, I saw movement," she insisted, her voice cracking. The physician frowned, frustrated by what he considered false hope. "Residual muscular spasms," he replied coldly, but his hands betrayed him, tightening on the stethoscope. He leaned closer to the infant's chest, listening for the impossible. The silence stretched, oppressive, broken only by the persistent flatline from the monitor. Then came a flicker. A faint, erratic blip appeared on the screen, vanishing just as quickly. The room erupted in conflicting emotions: disbelief, fear, and desperate hope. The doctor's face paled. "This can't be," he muttered. "Stillbirths don't reverse." The mother stirred weakly on the bed, eyes half open, hearing fragments that pierced her fog of exhaustion. "Alive?" she whispered. Panic followed. The medical team launched into resuscitation protocols, suctioning again, applying bag mask ventilation, adjusting oxygen flow. Each attempt met resistance, the child's chest rising barely enough to register. "Come on, breathe," a nurse pleaded, her voice breaking through the professional facade. Sweat trickled down foreheads, gloves snapped, instruments clattered. The room, once filled with despair, now pulsed with frantic energy. Yet every fragile spark faded almost instantly. The baby's chest stilled, monitors flatlined again. Hope rose and crashed like waves. Science declared futility, but hearts demanded one more attempt. The team debated in urgent whispers. "If we continue, we risk brain injury." Another shot back. "If we stop, we bury him." The ethical tension hung heavy, tearing at everyone's core. Outside the delivery suite, family members waited in a haze of confusion. Whispers of prayers echoed down sterile hallways, grandparents clutching each other's hands. Inside, the mother's sobs grew weaker, her body drained, but her spirit clung to one word: fight. She didn't care about odds or statistics. She wanted only one thing: to hear her baby cry, once, even if fleeting. Doctors faced a cruel dilemma. The chart was already signed: stillborn. To reverse that diagnosis risked ridicule, lawsuits, even disbelief from colleagues. But medicine is not just about charts. It's about the impossible moments when life whispers back against death. With a deep breath, the lead physician made the call. Prepare the neonatal incubator. We're not finished. The infant, pale and motionless, was transferred with trembling urgency. Tubes were placed. Warm air filled the chamber. Sensors attached again. The hum of machinery grew louder, as though the hospital itself held its breath. Every eye fixed on the monitor, waiting for proof of what their instincts screamed, that life still flickered within. And then, as the incubator sealed shut, a fragile chest lifted once more. Just a whisper of breath, but undeniably real. The numbers on the screen shifted, erratic yet present. Nurses gasped, tears spilling. The doctor's hands shook as he adjusted the settings, whispering, "Stay with us. Please, stay." Science stumbled, faith surged, and the impossible felt closer than ever. Still, danger loomed like a shadow. The breaths were shallow, inconsistent, and time was running out. Brain damage, organ failure, collapse, all hovered at the edge of possibility. The team knew this was no miracle yet. This was only the beginning of a battle against biology itself, and what came next would push medicine into uncharted territory. The incubator glowed softly, a fragile cocoon separating the newborn from the chaos outside. Monitors flickered with unstable rhythms. Oxygen hissed in short bursts, and the staff hovered like anxious sentinels. Every shallow rise of the baby's chest was a gamble. Would it fade again, or finally stabilize? The room felt less like a hospital and more like a battlefield where each second carried the weight of life and death. "We need clarity," the lead physician muttered, ordering an arterial blood gas test. The nurse inserted the needle with practiced care, drawing crimson life into the syringe. Moments later, the results appeared on the screen. Dangerously low oxygen, severe acidosis. The data screamed incompatible with survival. Yet the faint movements on the monitor insisted otherwise. Science and reality were in collision. The team reviewed the birth records again. Umbilical cord compression was noted, but not enough to explain revival after confirmed stillbirth. One resident hesitated before speaking. Could it be a case of delayed neonatal respiration? A sudden gasp syndrome? His words hung in the air, risky to even suggest. Such cases were nearly mythical, whispered among specialists, rarely documented, often dismissed as impossible. The mother, pale and trembling, was wheeled closer. She pressed her hand weakly against the incubator's glass. "Fight, my little one," she whispered, voice raw from hours of screaming and weeping. Tears blurred her vision, but she swore she saw the chest lift again, just enough to fog the incubator's wall. That faint mist was more precious than diamonds, proof that hope still lived. Nurses began to notice a pattern. The baby's erratic breaths weren't random. They aligned with gentle stimulation, a soft touch to the chest, a whispered sound. Even the mother's trembling voice seemed to spark movement. "He responds," one nurse said, eyes wide with awe. It was as though the child lingered between two worlds, choosing moments to cross back. A debate erupted. Some argued the body was merely reflexive, an echo of life soon to fade. Others insisted this was revival in progress, that intervention could tip the balance. The lead doctor, haunted by years of losses, clenched his fists. "If there's even a 1% chance, we take it. No baby fights this hard without reason." His words lit a fire in the room. They decided to escalate. Continuous positive airway pressure, CPAP, was initiated, forcing gentle streams of oxygen into fragile lungs. The hiss of the machine filled the room, louder than heartbeats, louder than prayers. The baby's chest quivered, resisted, then lifted again. A blip appeared on the monitor, stronger this time. The team leaned in, every eye wide, every breath held. And then it happened. The sound that cracked the silence like thunder. A shallow, rasping cry, weak but unmistakable. Nurses gasped, one covering her mouth, another letting tears fall freely. The mother sobbed with relief, pressing her forehead to the glass. That sound was not just biology, it was defiance, proof that the impossible could demand recognition. Yet with triumph came new danger. The cry was fleeting, the lungs still perilously fragile. "Don't celebrate yet," the doctor warned, though his own eyes shone with disbelief. "We're not out of the woods." Machines beeped, alarms flickered, charts filled with erratic numbers. But the staff had felt something they couldn't deny. A line had been crossed. Stillborn no longer defined this child. The turning point had arrived. What began as a whisper of breath was now a cry. Thin, fragile, but real. Medicine had no script for this moment. Doctors exchanged glances, knowing their choices ahead would define history, and perhaps redefine life itself. And the next decision would carry the highest risk yet. The first cry had electrified the room, but it was only a beginning. Within minutes, the baby's oxygen levels plummeted again, his chest rising unevenly. The weak cry dissolved into silence, leaving the team staring at a fragile body on the edge of collapse. Machines shrieked warnings, their piercing alarms echoing like clock ticks counting down to tragedy. Something drastic had to be done, and quickly. "We're losing him again," a resident shouted, adjusting the CPAP mask with trembling hands. The doctor's jaw clenched as he studied the monitor. Standard measures had been exhausted. What remained was uncharted territory, invasive, high risk, and rarely attempted in such newborn cases. His mind raced between textbooks, case reports, and instincts. Could this fragile child endure such an extreme intervention? The debate reignited. One nurse pleaded, "Doctor, he won't survive the procedure. His lungs are too weak." Another countered, "If we do nothing, he dies in minutes." "We need to try." The mother, still pale from blood loss, overheard the argument. She forced herself to sit up, her voice breaking through the chaos. "Please, don't give up on him. He's fighting." The lead physician made the call. "Prepare for intubation and ventilation. And if that fails, we escalate further." The staff froze, knowing what escalation meant. Mechanical intervention beyond the ordinary, techniques rarely used in neonates. It was bold, almost reckless, but sometimes medicine demands leaps into the impossible. The room moved as one, fear mixing with determination. The intubation was brutal in its delicacy. The tube slid past tiny vocal cords, guided by trembling hands and unwavering focus. Seconds stretched like hours. Then, a faint chest rise, a flicker on the oxygen monitor. Cheers almost erupted, but the readings remained unstable, dipping and climbing as though the baby's body was undecided about survival. "It's not enough," whispered the respiratory specialist. The decision loomed. Attempt an experimental bypass technique. Extracorporeal membrane oxygenation, ECMO, a heart-lung bypass rarely even considered for infants so small. The risks were enormous: bleeding, organ failure, death. But without it, the outcome was certain. The doctor's eyes locked with the mother's. "Do you trust us?" She nodded through tears. The team prepared the sterile field, the atmosphere tense with both dread and hope. Tubes, clamps, sterile drapes. The scene looked more like a battlefield than a nursery. The baby, no larger than a loaf of bread, lay beneath harsh surgical lights. "Steady," the doctor commanded, his own heartbeat pounding in his ears. One slip, one hesitation, and the fight would end. The first cannula slipped into place, blood coursing into the artificial circuit. Machines whirred to life, mimicking lungs, circulating oxygenated blood back into fragile veins. The monitor shifted slowly, hesitantly, like a reluctant tide turning. Numbers crept upward. A whisper spread through the room. "It's working." Nurses exchanged stunned looks, their disbelief overtaken by awe. The baby's chest eased, no longer gasping violently. Oxygen levels stabilized, heart rhythm steadied. Against all odds, the bypass had bought time. Relief swept the room, though no one dared celebrate fully. The risks remained immense. Bleeding could start at any moment, organs could fail, and the fragile victory could collapse without warning. Yet for the first time, survival seemed possible. As the machines hummed, the doctor whispered almost to himself, "He shouldn't be alive, but he is." The mother wept openly, her hand pressed against the incubator, whispering prayers of gratitude and fear. The staff exchanged weary glances. They had stepped beyond medical protocol, into the realm of miracles. And what happened next would prove whether science could hold on to this impossible life. Hours passed with the newborn connected to the bypass machine, his tiny body fighting against odds no textbook could justify. The room no longer buzzed with chaos, but with tense vigilance. Every beep of the monitor felt like a fragile promise. Nurses rotated in shifts, eyes fixed on screens that told the story of a battle between fragile lungs and borrowed time. The mother, pale but steadfast, refused to leave the bedside. Her hand remained pressed to the incubator's glass, whispering words of love that the baby could not hear but somehow seemed to feel. "You are not leaving me," she repeated over and over, as though sheer determination could anchor her child to life. Doctors noted something remarkable. His vitals steadied when she spoke. By dawn, faint improvements emerged. Oxygen levels, though unstable, climbed higher than before. Heart rhythms smoothed into a fragile but consistent pattern. One nurse whispered, "He's stronger than any of us expected." The doctor, weary but alert, nodded. "He's teaching us medicine we've never practiced before." The impossible had begun to transform into undeniable evidence of resilience. Gradually, the team reduced support. First, oxygen flow lowered. Then, bypass support was eased in careful increments. Each adjustment carried the threat of collapse, yet the baby clung to life with astonishing defiance. Every small victory drew gasps of relief, nurses exchanging smiles through tears. The mother, though drained, whispered one word with each improvement: miracle. The medical explanation, though plausible, never felt complete. Specialists suggested delayed neonatal respiration, a rare phenomenon where the body suddenly triggers breathing minutes, even hours, after apparent stillbirth. Others argued it was uncharted physiology, an event beyond current science. But in the hearts of those present, the truth was simpler. The baby had returned from silence when no one thought he could. Days turned into weeks. The child remained in the neonatal intensive care unit, surrounded by machines and watchful eyes. His weight grew slowly, color returned to his cheeks, and his cries grew stronger. The mother's arms finally cradled him without wires, her tears soaking the blanket. The staff gathered, humbled by what they witnessed, not just survival, but transformation. This child was declared stillborn, the doctor admitted to colleagues, and yet he lives. His words carried awe, humility, and fear. For years he had seen patients die despite every effort. Now he faced the opposite, life blooming where it had been clinically denied. Medicine had been challenged, and with it, the very definition of possibility. The story spread through the hospital, whispered among nurses, echoed in hallways. Families waiting with their own tragedies clung to this tale of hope. "If that baby can survive, maybe ours can too," one father murmured in the waiting room. The impossible revival became more than a medical case. It became a symbol of endurance, faith, and the thin line between despair and wonder. Eventually, the baby was discharged, swaddled in his mother's arms as cameras from local news captured the moment. His tiny yawn seemed ordinary, yet everyone who witnessed it knew it was extraordinary. Against statistics, against diagnosis, against finality itself, he lived. Doctors recorded it as a rare event, but families called it by another name, a miracle. Years later, those present would never forget the sound of that first improbable cry, the moment silence surrendered to life. Medicine had documented the details, but hearts remembered the feeling: awe, disbelief, and gratitude. The stillborn child who breathed again was no longer a case file. He was proof that even when science writes the ending, life sometimes chooses to turn the page. The case of the baby declared stillborn, only to breathe again, stands as one of medicine's most humbling reminders. Science explains much, but not everything. In sterile halls filled with monitors and protocols, life sometimes slips through rules and definitions. For the mother, it was more than survival. It was the rebirth of hope when the world had already handed her despair. Doctors called it delayed neonatal respiration, a rare phenomenon. Families called it a miracle. Whatever the label, the experience reshaped everyone who witnessed it. Nurses who once carried only grief now carried a memory of triumph. The lead physician admitted, "I've seen death countless times. This was the first time I saw it step aside." The impossible had become undeniable. But one question lingers for us all. What do you think truly saved this baby's life? Science or fate? Share your thoughts in the comments. And don't miss what comes next. A story of another patient whose laughter nearly turned deadly, leaving doctors horrified.